A venomous lizard crawling in the deserts of the American Southwest doesn't exactly sound like the start of a medical miracle, right? But this creature helped scientists create a drug that's now reshaping the future of health, from reversing diabetes to fighting Alzheimer's, and even changing the way we lose weight. It's called Ozempic, and it might be the most talked about drug on the planet. But is it really a breakthrough? Or are we just chasing another quick fix? It might sound unusual, but the key to a groundbreaking drug was found by studying a venomous lizard. Meet the Gila monster, a creature native to the deserts of the American Southwest. Now, what's so fascinating about this lizard? Despite only eating large meals a few times a year, sometimes consuming up to 30% of its body weight, its blood sugar levels remain remarkably stable. This is a huge mystery for scientists. How does this creature maintain such control over its blood sugar while feasting on large prey? The answer lies in a hormone called Exendin-4. Exendin-4 is released during digestion and helps regulate blood sugar by stimulating insulin production. What's even more intriguing is that this hormone mimics the effects of another hormone in our bodies, GLP-1. So scientists took inspiration from the Gila monster's unique ability and began developing GLP-1 receptor agonists to help with blood sugar regulation in humans. This research led to the creation of Ozempic, a drug initially designed to treat type 2 diabetes. Ozempic works by mimicking Exendin-4, improving insulin sensitivity, and reducing blood sugar levels. But as scientists dug deeper into its effects, they realized Ozempic's potential went beyond diabetes. Now, here's where things get really interesting. Ozempic wasn't originally designed with weight loss in mind, but as more people started using it for diabetes, something unexpected happened. Many patients began losing weight, and not just a little. For some, the results were remarkable. This created a buzz that quickly spread beyond the medical community, and before long, Ozempic was being seen as a potential weight loss miracle drug. The way it works is fascinating. Ozempic targets GLP-1 receptors in the brain, which are involved in controlling hunger. By activating these receptors, the drug reduces appetite and increases feelings of fullness, making it easier for people to eat less. But it doesn't just affect appetite. It also slows down the digestion process, which helps people feel satisfied for longer periods after eating. In fact, clinical trials have shown that Ozempic can lead to significant weight loss in many individuals, with some shedding 10% or more of their body weight. This effect has led doctors to prescribe it to patients who are overweight or obese, but do not have diabetes. However, this rise in demand has also brought up ethical concerns and questions about whether it's fair for those without medical need to use a drug originally designed for chronic diseases. But the story doesn't end with diabetes and weight loss. As scientists continued to explore the effects of Ozempic and its active ingredient, GLP-1, they uncovered something even more surprising. It turns out that this drug could have a significant impact on Alzheimer's disease and heart health, two of the most devastating chronic conditions of our time. Let's first talk about Alzheimer's. We all know how heartbreaking it can be to see a loved one suffer from cognitive decline. Alzheimer's is a disease that destroys memory and thinking skills, leading to the loss of independence. But recent studies suggest that Ozempic could play a role in preventing or slowing the progression of Alzheimer's. Research indicates that GLP-1 receptors are found in the brain, and when activated by drugs like Ozempic, they may help protect neurons from damage. This could potentially reduce the buildup of beta-amyloid plaques, which are thought to contribute to the disease. While the evidence is still emerging, the possibility of a drug originally designed for diabetes also being effective for Alzheimer's is a game changer. Now, let's shift gears to heart disease. We often think of Ozempic as a weight loss aid, but it's also showing promise in improving heart health. Cardiovascular diseases, including heart attack and stroke, are the leading cause of death worldwide. The connection between obesity and heart disease is well established, but recent studies have shown that Ozempic can significantly reduce the risk of cardiovascular events, particularly in people with type 2 diabetes. Ozempic works by not only controlling blood sugar, but also reducing inflammation, improving cholesterol levels, and promoting better blood circulation. These combined effects are believed to lower the overall risk of heart disease, making Ozempic a potential breakthrough treatment for both diabetes and heart-related issues. While the potential benefits of Ozempic are undeniable, it raises an important ethical question. Is it fair to use a drug originally designed to treat chronic diseases for weight loss in otherwise healthy individuals? Many celebrities have openly admitted to using Ozempic for weight management, and this has sparked a conversation about the pressure to conform to society's beauty standards. For some, it may seem like a shortcut, a quick way to lose weight without the effort of dieting and exercise. But is that really the case? It's tempting to see Ozempic as an easy fix, but it's crucial to remember that this drug was developed to manage diabetes and potentially help those suffering from serious health conditions like Alzheimer's and heart disease. The question is, should it be available for cosmetic purposes, or should it remain a medical treatment for those in need? And what about people who are overweight or obese, but do not have diabetes? Should they be able to access Ozempic for weight loss, or does that run the risk of further complicating an already overcomplicated beauty culture? Another layer to this ethical dilemma is the accessibility of the drug. As demand for Ozempic has skyrocketed due to its weight loss benefits, some people who actually need it for diabetes management have found themselves unable to access it. Is it right that a drug designed to improve the lives of people with chronic conditions is now being diverted for non-medical uses? This complex issue forces us to rethink how we define health, beauty, and access to medical treatment. Now let's dive into how Ozempic works at a biological level. But don't worry, I'll keep it simple. At its core, Ozempic is based on a naturally occurring hormone in the body called GLP-1. Glucagon-like peptide 1. This hormone is crucial for regulating blood sugar levels. When we eat, GLP-1 is released, stimulating the pancreas to release insulin, which helps lower blood sugar. But GLP-1 does more than just regulate insulin. It also slows down digestion and suppresses appetite, making us feel full for longer. Now here's the twist. In Ozempic, the drug mimics the action of GLP-1 by activating the GLP-1 receptors in your body. By doing so, Ozempic not only helps your body produce insulin more effectively, but it also reduces the amount of sugar your liver releases into your bloodstream. This helps lower overall blood sugar levels, making it incredibly beneficial for people with type 2 diabetes. But that's not all. The drug also works on the brain by targeting hunger signals. This leads to decreased cravings and an increased feeling of satiety, helping people to eat less without feeling hungry all the time. Essentially, Ozempic is a multitasker, regulating blood sugar, aiding in weight loss, and even helping reduce the risk of heart disease, all thanks to its ability to target GLP-1 receptors throughout the body. So, after all this, should you be excited about Ozempic, or should you be concerned? The truth is, it's a bit of both. On one hand, Ozempic has shown incredible potential in treating diabetes, helping with weight loss, and even protecting the brain and heart. It could genuinely improve the quality of life for those with chronic conditions. But as with any breakthrough, we need to be cautious. We must ask, should a drug designed for chronic conditions be used for cosmetic purposes? And, more importantly, is it ethical for those who don't need it medically to gain access over those who do? It's clear that while Ozempic holds promise, we must carefully consider the broader implications of its use.